Thank you, Vicki. Good morning, everybody. Before we get started, I just want to thank you guys all for starting your Sunday morning off by doing something to help the environment. What Stand Up for Trash does is so important, and that's empowering people to do something that can make a difference. It's kind of hard to find those outlets that can really help. And I've had the luxury of kind of working around the U.S., and I will say that Dana Point Marina is one of the cleaner marinas that I've had the pleasure to be working in. And that probably has a lot to do with this program, cleaning up the marina every month. So thank you guys all for contributing. Some of my favorite sea lions live in this marina. So by you guys cleaning it up, it gives them a safer home. So I really appreciate that. So for those of you that don't know, how many have heard of the Pacific Marine Mammal Center? Raise your hand. Oh, good. Our people are here. Go figure, you're picking up trash. Thank you, guys. So we're a rescue and rehabilitation facility for sick and injured marine mammals that strand along anywhere in Orange County. So we cover from San Clemente all the way up to Seal Beach. Dana Point Marina is actually one of our very common rescue locations, and we actually rescued an animal this morning over from Harbor Patrol that was having some seizures up on the rocks. So I think I have what is probably one of the coolest jobs in the world, which is probably why I work so hard to get it, and that is a wildlife marine mammal veterinarian. So raise your hand if you have pets at home. I see a couple have made the talk. Good. And how many of you have taken your pets to a veterinarian? Sometimes when they're healthy, right, to get their vaccines, and occasionally when they get sick, right? How many of you guys have actually been to a doctor yourself because you've been sick, or even just when you're healthy, right? Has anyone thought about what happens when wildlife gets sick? How they check into the hospital? Does anyone know how we get our patients in the hospital? If Lonnie was here, she would. Go ahead.
People bring them into you, or they call you and have you come out to pick them up?
Exactly. So it's basically the general public and lifeguards that give us a call when they come across a sick or injured marine mammal. And so without the help of the general public calling us, we would have zero business because we're not large enough to actually go out and patrol for sick or injured animals. So we'll usually ask people to give that animal their distance, take a picture using your Zoom, so we can assess whether or not that animal is in need of help, and then we'll send out a rescue team. Something that's pretty amazing about the Pacific Marine Mammal Center is we're a pretty small staff. We have, depending on if it's our busy season or slow season, anywhere from 20 to 25 people on staff. But we have over 150 volunteers that take care of our patients in the hospital, that come out and do education events like Rob's done today for you guys, and that also go out and do rescues and get the animals off the beach when they need our help. So we'll send out a rescue team if an animal needs their help, and like this morning, we usually use nets. Occasionally in Dana Point Marina, you guys will see us using remote sedation, which is a PC way of saying dart gun. Because some of these animals are quite large and don't really like to participate in their medical care. So sometimes we have to give them a little bit of medication to make them go to sleep, to make it a little safer for our rescue teams to get nets on that 600 to 800 pound adult male sea lion that you guys see out here on these docks. We can definitely go skiing behind them in nets if we don't convince them with a little medication, and that's very unsafe for us and the animal. So a couple things about us at the Pacific Marine Mammal Center, just general things that you guys can know, is number one, yes, we rescue seals and sea lions. The vast majority of our patients are pups, so little babies that are kind of learning how to fend for themselves out in the wild, weaning from their mom, taking care of them, and learning how to kind of fend for themselves and hunt. And as you parents probably know, childhood is a time when sickness kind of creeps up on you. So either these baby sea lions and seals are having a hard time learning how to catch fish, or they have some kind of illness that comes up where they get pneumonia or some kind of injury and they end up sick on the beaches. Those animals are, I don't want to say easy to rehabilitate, but we're pretty good at it. We have about an 85 to 90% success rate with the California sea lion babies that come through, and almost 100% success rate with the young elephant seals and harbor seals. We also do cetaceans. Does anyone know what a cetacean is? Go for it.
Either dolphins or whales.
Dolphins or whales, exactly. So we have the expensive words are odontocetes, which are toothed dolphins, like you think of your bottlenose dolphins, sperm whales, pygmy killer whales, short-fin pilot whales. And then you have your mysticetes, which are baleen whales, so the gray whales, the things that are filter feeders. And so we respond to any sick or injured dolphins, and a lot of times when they hit the beach, it's usually not going to be a great outcome. They're supposed to be in the water, but the best thing that you could do for them is if you come across a sick dolphin on the beach is not to push them back. I know on the internet you see a lot of those videos where people think they're doing that animal a favor by getting them back into the water, but what's one important thing to realize when you're pushing a dolphin back in the water that's sick? Does anyone know? It needs air. A+ for you. So they're marine mammals, right? So they breathe air, and if they're sick or weak, sometimes they'll beach cast themselves because they're having issues making it to the surface to take breaths. So the best thing you could do is if you come across a sick or injured cetacean is to let the lifeguards know or call a rescue facility to come out and see what that animal needs. And then we do have a pretty cool whale disentanglement team. So we have some pictures here to kind of show you guys what some of our rescues look like. So this is somebody on our whale disentanglement team. Believe it or not, that's the fluke of a gray whale right there, and it's entangled in some fishing gear, one of the most common entanglements we see in our whales. And so we have teams that are highly trained and work under the supervision of NOAA, which is the federal government facility that is responsible for taking care of all wild marine mammals. And we go out onto the water in our little boat named Blue with our whale disentanglement team and NOAA to help get that fishing gear off those animals. So it would be practically impossible to bring a 40,000-pound whale into the hospital. So sometimes we bring the hospital out into the water and take care of them there. And then recovery and rehab looks different depending on what you come in with and why you're sick. We have 3 veterinarians at the Pacific Marine Mammal Center, 1 veterinary nurse, which isn't the great ratio. That poor nurse has to take care of 3 doctors in addition to all of our patients. And then we have a really big animal care team that's responsible for feeding these animals, getting them the nutrition that they need, and getting the medications and treatments that are prescribed to them by their veterinarians into them. So with the babies that we have, we usually will start tube feeding them, get them on fish, give them some antibiotics, the same that you may take if you have pneumonia or your pets might take. And then we make sure that they're doing well throughout their rehab process. We do things like take x-rays, do ultrasound, run blood work. We even test them for COVID, believe it or not, if they have respiratory signs, just to monitor and make sure they don't have it. It's never been documented in a seal or sea lion, so luckily it's a non-issue right now. And then once they're looking like they're of good weight, we do a release exam on them, and then we bring them back out to return them to their ocean home. So those releases are pretty special. And like I said, we're pretty good at rehabilitating the babies. Now it's going to get a little bit sad, and then we'll get a little less sad. So when the adult animals come in, sometimes those adult animals have health issues that are really challenging to treat. As you guys can imagine, your own pets kind of mask their signs when they're feeling sick. It's kind of a survival mechanism when you're out in the wild. So a lot of times when the patients come up on the beach, especially the adult animals, they're very, very ill. So does anyone know one of the most common causes of adult sea lion stranding, at least in Orange County?
I'm just guessing because lately, is it the domoic acid
Yes.
problem?
A+, you're hired. So does anyone know what domoic acid is? I'm hoping that some of you guys have at least heard of it. Exactly. So it's a harmful algae. So not all algae is bad. I just want to advocate for the marine algae out in the world. Most of the marine algae is friendly algae. It's actually one of the most important carbon sinks that are hopefully going to save us from climate change. So most algae is doing great out there, living its best life. There are a smaller group of species of algae, one of which is called Pseudonychia, that produces a toxin. And this is specifically a neurotoxin known as domoic acid. So you guys have probably seen in the news, if you're locals, that there's been some aggressive sea lions, and there's been some human and sea lion interactions where people have been bit. Over the past 2 months, we've had one of the largest domoic acid blooms that have ever been recorded in our region, in the whole Southern California bight. And we've seen a massive influx of adult sea lions, particularly the female sea lions, coming in having seizures related to ingestion with this neurotoxin. So I'll just defend our little sea lions right now. They can be aggressive, and you do need to maintain your distance. About 50 yards is what they recommend. 50 feet is good. Any closer, and anything that happens between you and that sea lion is probably your fault. So please respect wildlife and give them their distance. And anything with a mouth can bite. They remind us that in veterinary school almost every day. And that's very inclusive with wildlife. Most of the time when they're scared or frightened, they will bite. And if they're sick and injured and approached by a member of the public, they could retaliate and bite. So those animals that had bit people recently that you've seen in the news are more than likely intoxicated with this toxin, having seizures in the water, and then interact with the surfer or swimmer and accidentally bite that person. So during the past 2 months, this domoic acid bloom started around June in our area, a little bit earlier up in the Santa Barbara area. On average in June and July, we respond to about 5 to 10 sea lions, and usually those sea lions are babies that are just kind of learning how to wean from their moms and fend for themselves. This June and July, we've responded to 120 animals, 10 of which were dolphins and 110 of which were California sea lions. So the magnitude of stranding is about a 20-fold increase compared to what we would historically think of. And these animals were adult females for the most part, some subadult, so teenage sea lions as well, and primarily sea lions. Does anyone know why, and this would be like a super extra credit question, you have to know a lot about sea lions, but why we primarily would only see adult female sea lions this time of year succumb to a toxin that they're eating in their fish? It's kind of good.
Is it because you're finding most female dolphins? Dolphins. Is it because when they swim in the water that's contaminated with the domoic acid, does it get contaminated in the milk so they can't feed the kids and the little ones?
That's a great guess. This is what we call a hydrophilic toxin, so it can be excreted in their milk to their babies, so that's something we have to worry about. But you kind of hit on it indirectly. So it's because over the summer, it's sea lion breeding season. And just like in people, the males are very focused on making babies and don't really think about much else for about 2 months, and that includes eating as well. So those big boys that you usually see out on the docks around April and May time, if you guys were out here, you saw there was almost 80 animals, adult males at one time trying their best to sink these docks. Those boys are essentially coming back down from the Washington, Oregon, Northern California area where they spend the fall, winter, and spring. They come down, make their way to the Channel Islands where all the moms are with their babies. And then once the mom has their baby, in about 2 weeks, she ovulates again and is ready to get pregnant. I know all the mothers in the audience are like, are you kidding me? It's a lot. Sea lions are baby making machines. That's why the population is so healthy. Every year, as long as the mom is healthy, she will have a baby. Their gestation is very interesting. They have something called delayed implantation. So they get pregnant around July and the embryo doesn't start growing until November. It just hangs out while she's lactating and feeding that newborn baby. And once the lactation intervals decrease, that embryo inside of her knows to bind to her uterus and start growing. So the gestation period is only 9 months, but they're actually pregnant for 12, which is super cool. And that's primarily because the boy sea lions only are around for like a month and then they take off again. So you got to take the opportunity when you can, right? So these mom sea lions basically are pregnant as they're lactating, taking care of their mom or their babies. And one of the other things that a lot of people don't realize is, does somebody know it's the #1 cause of stranding of adult animals in our region? So it's domoic acid is technically that when we have years like this, but there's another background thing with the sea lions in our area that every local should know about. So does anybody know what that is?
Is it plastic trash and plastic pollution?
That is a big issue we have with our animals, but not the #1 in the adult animals. Go ahead.
Is it line entanglement?
No, that's very close, but that's our 3rd most common cause of stranding.
That's what I was going to say.
Okay, so it's actually cancer. Did anybody know that California sea lions have the highest rate of cancer of any wildlife species right off our coast? So when that happens, that's something that's very important to pay attention to. It is not normal for wildlife to get cancers, particularly at the rate that we see in California sea lions. Does anyone want to guess why they have such a high rate of cancer?
Is it the toxins washing down from fertilizer and the water and going in?
You're about halfway there.
Okay.
Anyone else? It starts with a D. There's another D, and it ends in a T. Does anyone know about the DDT issues that happened that are spilt off our coast? Does anyone know what DDT is? Oh man, I'm never gonna let go of the mic. This is great. It's a weed kill. It's an insecticide. So between the 40s and the 80s, Montrose was a company that existed on the San Pedro area peninsula, and they produced something called DDT, which was great anti-malarial drugs because it killed mosquitoes. They used to spray it on our soldiers. For those of you old enough, you might remember trucks going through your neighborhood spraying this insecticide, and the parents would send the kids out to go run behind the trucks. Well, it turns out DDT causes cancer, and back in those days we didn't know any better, and we allowed that company to discharge DDT from the sewage system into the Palos Verdes Peninsula area. So we've known for a long time that's a Superfund site. And then in 2020, there was a researcher named Dr. David Valentine that was doing some deep sea exploration, and he had a weather day. And so his team came in and were using the ROVs around Catalina Island just to get some practice in some not so deep water. And they started bumping into barrels that had this weird glowing material around them, kind of everywhere. And it turns out that that company ended up dumping additional DDT barrels all around the Channel Islands between the Palos Verdes Peninsula over to the Channel Islands. So for the past 40 years, we've known that sea lions have an incredibly high rate of cancer. And I would say within the past 10 to 15 years, we've now determined that that's the result of the high DDT levels in their blubber. And they're also able to mobilize that contaminant into their milk and pass it down to their young. And then in addition to that, there's a viral infection that they can get. That's an oncogenic or cancer-causing virus. And it's the combination of those two things together that result in sea lions off our coast to have the highest rate of cancer of any wildlife species. So I'll just, spoiler alert, tell you I don't know what to do about that. That's everyone's first question. But I will say proactively, moving forward, trying not to put things in the ocean that we don't know what it's going to do is probably the most important thing that we can do. And I bet you in about 30 years from now, people are going to look back at the plastics that we're using and kind of laugh at the pictures of us holding water bottles in plastic, drinking from them, and knowing that we've put those plastics out in the environment. So cleaning up the plastics like you guys are doing today when they're in a form where you can still see them and pick them up is so important, because UV light and salt water and degradation over time breaks up those larger plastics into smaller plastics, and those are called microplastics, which are practically impossible to clean up. And although we can't go back in time and change what they did with the DDT, that's resulting in major environmental issues, we can, moving forward, make smarter decisions on the stuff we use. So my charge for hope for all of you guys is, number one, you guys just sitting here today, taking responsibility by cleaning up the harbors that you guys live around. I'll also say you should be conscious consumers. You would be so surprised how easy it is to cut a lot of the plastic out of your life. So I'm a doctor, and we use a ton of plastic for our IV lines, our medical procedures, our sterile equipment. There is a responsible and appropriate place to use plastics. And I always tell people, don't let perfection get in the way of progress, right? Do the best you can, as much as you can. Don't be too hard on yourself when you do have to buy a plastic water bottle. But also think about ways, every time you come across a piece of plastic in your day-to-day life, try and figure out a way that you can replace that. So I'll do a little plug. I actually think they've done a talk for you guys, the Eco Now stores. They're absolutely incredible. They're basically these bulk stores that if you're in the financial demographic that has the ability to purchase materials that are sold in bulk, like stores like this. I buy all my laundry detergent from there. I buy all my dishwasher pods from there that are biodegradable. I buy all my hand soap from there. They actually have some really great conditioner. I haven't found a shampoo yet I love. But it's those kind of things that if everybody did a little bit, it would be chipping away at the waste. So instead of being proactive like you guys are being today by cleaning it up, you're being proactive by preventing that. And then the last thing that I'll tell you guys to do is to shop locally. I think one of the problems that people don't realize that hopefully was put on people's radar during the pandemic is the amount of shipping ships that are coming across the Pacific Ocean. And a lot of that has to do with our Amazon orders and the demands that we're having for things to show up at our doorstep very quickly. So instead of ordering something off of Amazon, if you could figure out a way that you can get it from a local store or go to a farmer's market for a lot of your produce, that can actually really decrease the demand for those things being shipped across the Pacific. And those cargo ships are the #1 killer of whales in the water. And people don't realize how many whales die from boat strikes associated with cargo ships like that. And in addition to that, the noise that those ships make are deafening to the cetaceans in the water, and they have a really hard time communicating and migrating. So although you may not see that connection of your day-to-day choices that are making a drive for these things, there's a lot of things that you guys can change in your day-to-day life that can really help animals. We're not as disconnected from them as we seem to think. So with that, I can take questions. Yes? Okay, good. So anyone have any questions about anything we touched on? Go ahead,
So how
Vicki.
many patients do you have at the facility right now?
Right now, it's a moving target because we just rescued one this morning and we released 2 on Thursday. I think we are at 26 patients. At the peak of the domoic acid bloom, we had about 78 patients total, and those were all adult animals, which are very challenging to manage. 78 rowdy, rambunctious sea lions once they're feeling a little bit better. And this year so far, we've responded to about 225 sick or injured marine mammals since January 1st.
And then can we be a part of the release? Because I see like the pictures on social media, a lot of people are on the beaches. How do you get to be a part of that?
Yeah,
to see that?
we have a membership essentially.
Okay.
We don't like to announce our releases super publicly because the animals can be a little bit skittish, especially as they're seeing the ocean for the first time in a long time. So we try and actually fly under the radar a little bit, but if you come visit the center, you can become a member, and then we let certain releases on people's radar. With the animals, every sea lion has a little bit different personality, so some of the shyer ones we won't really tell people about because we don't want them to be nervous, and then some of the show-offy ones we're more than happy to invite the general public. Go ahead. Sure. Yeah, I'll repeat those questions for you guys. No problem.
What is the status of the sea lions as far as their protection?
Okay, so the question was, what was the status as far as the sea lions when it comes to their protections? The first thing I'll say is all marine mammals in the U.S. are protected by the Marine Mammal Protection Act, which was passed in 1972 and is a great example about how policy and protections can really improve populations. So the sea lion population was actually almost non-existent, and ever since that was put in place, it has been rebounding. So right now, the estimate for the sea lion populations is about 250 off the Southern California Bight. 250,000, sorry, yes, a much bigger number. You're like, they all live in the harbor. 250,000 to about 300,000. Most of those animals live on the Channel Islands, and you'll never see them in this direction. And then I will say that there's a rookery essentially that's being created down in La Jolla. I think it's the coolest thing in the world, but there's a lot of negative human interactions down there. But it's pretty incredible. If people just keep their distance, the opportunity to see mom and baby sea lions nursing, giving birth, the babies learning how to play and swim is practically like a National Geographic episode happening in the middle of the city in La Jolla. And there's really no other sea lion rookery on the coastline that is accessible to be able to see that. You have to go out to the Channel Islands, and that's limited. So I would encourage you, if you guys want to see some cute stuff, to go view those baby sea lions. There's still little ones down there, but at a respectful distance, bring some binoculars and a camera with a good zoom lens, and you'll capture some pretty incredible stuff. That's in La Jolla, yeah. Any other questions?
What is the algae?
Domoic acid.
Is that still an issue right now?
So the question was, is the domoic acid bloom still a big issue right now? It has dissipated significantly, which is wonderful, although this was one of the longest blooms that we've had and one of the most widespread, so thousands of animals were really impacted by it. And we're still seeing the lingering effects. Domoic acid, without getting too sciencey on it, mimics something called glutamate, which is something that binds to your glutamate receptors, which is in the hippocampus in your brain, as well as your heart. And it stimulates those receptors to fire, which is what results in seizures and heart damage. So the animal we rescued this morning, her name is Queen. She's actually a patient that we rehabilitated in our hospital and released on Thursday. If they have seizures for too long, it can reinforce that seizure pathway and essentially turn them into epileptics. And it's obviously not good to be an epileptic marine mammal that has to breathe air. So if you don't stop the seizures soon enough and flush out the fluids, the lucky ones are the ones that made it through our hospital and were able to do that. But even still, there are some animals like Queen that we can't bring to the other side. And so we tried to release her thinking she was okay, and then this morning she was reported to be having seizures on the rocks. So we rescued her, we'll bring her in to perform an MRI, but she more than likely, because that bloom has dissipated, is suffering from chronic long-term impacts from the toxin exposure that she had. And that's what we're seeing right now, is these chronic animals kind of coming up, and it makes them not be able to navigate in space and time. So they're very confused, they're acting abnormal. These are the sea lions you hear about walking down the highway or crossing PCH. They don't really understand which way the ocean is or where to find the fish. So it's really, really hard to see not just the acute problems or the real-time problems that are happening with the ingestion, but more of the long-term issues that impact these animals. Okay.